It would be great if they left with a sense of curiosity about what they need to understand to be good collaborators, and hopefully they will make some connections and form some relationships that will serve them well as they continue their education.
This is probably one of my most favorite days of the year. Today we'll have over 900 students and faculty and 13 disciplines talking about how we can work better as a team to deliver health care. This is the future of education, and I can't be more proud of everybody who's here today and who's actually worked so hard to make this event so successful.
In the best healthcare settings these days, they really are focusing more on the patient themselves and putting them at the center of care, and it really requires a coordinated effort for all the members of the team to work together in order to make sure that the patient gets the best outcomes. They get that opportunity to have good conversations with one another and meet each other not just as members of the team but as people. I think it's really fun for them to come together and engage with students outside of their own college, since they spend the majority of their educational career inside their one building. So this opportunity to sort of establish those connections, to break down those barriers and know that they're just other members of the team that they can interact with as students, and then again make it easier for them as professionals.
We are looking into the future, into a world that is increasingly more complex, increasingly urban and global, and will depend more and more on a new generation of thinkers, scientists, and researchers, well conversed in the language of collaboration between disciplines and also, quite frankly, between cultures. I want to make sure also that you can play in the same sandbox and there is nothing lost in translation. When you talk to each other, you understand each other, and you all collectively take good care of me. That's why we need interprofessional education, to make sure that nothing gets lost in translation.
My name is Celine Dalday, and I'm in the College of Nursing right now getting my BSN. I actually work as a PCT at a hospital, and I work with a lot of physical therapists. So a lot of the time they take my patient and I don't exactly know what they're doing with them. So with IPE Day, I just got a better grasp of what physical therapists did, or even doctors, and like what their actual roles were.
My name is Chris Mendiola. I am studying health information management. I love seeing all the different perspectives that you could see in medicine. We get to come together and combine our strengths to create better quality care.
I am always so amazed and enthusiastic by working with students of whatever profession, particularly here at UIC. I think we have fantastic students with a great eye on the ball with regards to social mission. Healthcare is definitively a team sport. It is really important to teach foundational knowledge and concepts so people gain the respect for other professions and realize that there's an authentic expectation of them by the time that they graduate.
I'm Olivia Bimby, and I'm in the College of Nursing. If I don't know what my doctor can do for my patient versus a physical therapist versus a pharmacist, then I'm not providing the best care for my patient in the end. And it was just super helpful to learn what these different disciplines can really do for my patient. Obviously, everyone who works in the healthcare field is going to tell you that they care about people and they want to help people. And what's nice about healthcare, especially being a nurse, it's like I get there and then I realize that there's more. I can do so much more if I just keep going. And there's always new things to be working on and new people to work with, and new professions are coming out. And there's just always something to improve on.